Government and investor remain at odds over Pelican Paradise Resort construction. Solar power promises brighter future for Atauro Island residents. Telemedicine technology to bring diagnostic tests closer to municipalities. Hi, welcome back to RTTL World News. I'm Sonia Madeira. It's been over a month since the government gave a 10-day deadline for Pelican Paradise Group to vacate the prime waterfront site where it plans to build a 5-star hotel. However, nothing has changed at the site, and Pelican Paradise Group claims it has yet to receive any formal notice from the government.
After years of delays, a $700 million project remains in limbo. The government has established a team to probe the details of the special investment agreement and resolve ongoing issues for the parties involved.
We need to weigh carefully when making the decisions because they have networks of businesses, industry, and investment, and we don't want to give an impression that damages our state image. So we continue to make a careful approach with them based on our capacity to provide solutions to the current problem.
In April, Prime Minister Sanana Gusmao confirmed the government would give Pelican Paradise 10 days to leave the premises to make space for new investors. The government expressed plans to terminate a special investment agreement signed by both parties in 2022 due to a lack of activity on the site. In a written statement, however, the Pelican Paradise Group clarified that they haven't received a formal notice to vacate the land, despite public statements from government officials. Pelican Paradise has not received any formal notice or official document from the government requiring the company to vacate the project site or confirming any final termination of the project. Under the agreement, it falls upon the government to clear the land for the construction and provide water and electricity as preconditions for Pelican Paradise to move forward with the project.
I went there and saw there is electricity on the site. We have installed an electrical transformer on the site, but they requested a bigger power transformer, but there is no construction activity there. Why should we install a big power transformer there? And also water. We have identified a water source, but why should we pipe the water there? Unless they start doing some kind of construction activity there, so that we can pipe the water for them.
Pelican Paradise Group claims the electricity supply does not come close to what is required, and there is no water supply available within the project site. The first phase of construction requires 250,000 to 300,000 liters of water and 1 megawatt of electricity per day. Moreover, the water source identified is a borehole located 2.1 kilometers from the project site, outside the site boundary on private property. The company has received requests from the government for meetings regarding the project, and the group remains open to discussion. The correspondence received so far has been related to requests to arrange meetings regarding the project. Pelican Paradise responded promptly and remains available for discussion. Those meetings have yet to take place. Pelican Paradise Group acquired the prime waterfront land in Tibar in 2008 to build Timor-Leste's first 5-star resort, a hospital, golf course, shopping center, and luxury villas. Under the agreement, any disputes are to be referred to and resolved by the Singapore International Arbitration Center. Pauline Quintão, RTTL World News.
After more than 2 decades of independence, hundreds of rural households on Atauro Island still lack access to electricity and telecommunication services. Island residents say they are relying on self-funded solar panels and limited government support. But these small-scale systems lack the capacity to support high-power appliances. Judianto Suarez's family lives a simple life in Atecru, an hour's drive from Atauru town.
Since the Indonesian occupation until now, we use solar panels because our place is far from the city.
In 2023, the United Nations Development Programme distributed solar panel kits to 362 households across Atauru Island. But Mr. Suarez told RTTL World News that the solar panels only supply enough power for 4 light bulbs, forcing the family to buy more panels so they can watch TV.
When it rains and it's cloudy, then we have no power. If there is no power, we use the torch or live in the dark because we live far away from the store to buy candles.
Located just 30 kilometers north of Dili, Atauru Island is home to some of the richest coral reefs in the world, teeming with sea turtles, dugongs, whales, and various fish species. This incredible biodiversity opens major business opportunities for more than 12,000 people living on the island. However, limited access to electricity, communications, and internet networks make it incredibly difficult for local small businesses to survive and grow.
I don't sell cold water because there is no electricity. We can use a generator, but it needs to be the big one and it needs diesel to run.
I started a guest house business in 2024, but it's so hard to get bookings because we don't have much connectivity here. I need to go to the beach to get signals and access the internet to reply to clients' bookings. Every day I need to go down to the beach twice, in the morning and in the afternoon, to check if I get any bookings.
The local government said a technical feasibility study for solar PV installation has completed and the procurement will open this month.
I think renewable energy is better because we can promote green energy on Atauru Island. It is more expensive to transport the fuel and the oil prices are now rising sharply.
Both local authorities and residents agree that the renewable energy is the best way forward as it is both sustainable and affordable.
I think electricity is good, but we spend more money to buy prepaid tokens. So using solar panels is much better for us who live in remote areas. But we need high wattage solar panels, so we can use them for many things like cooking and other things.
When we using renewable energy, we only spend money to buy kits and installation. But the non-renewable one, it's expensive because we need to pay through buying prepaid tokens.
Mr. Bello said that renewable electricity is a better option for the island community.
Each shipping of diesel for electricity costs $8,000, and every month we need to do at least 2 shippings, so that cost is higher. Therefore, for Atauru, we prefer PV solar panels to reduce the cost. When the cost is smaller, means power is affordable for the island community and it can help boost local businesses.
The government has committed $10 million for the solar PV project in Atauru Island alone. Paulina Quintaun, Sonia Madeira, RTTL World News. The World Health Organization's Say No to 5S program is coming to an end later this month after 4 years of working to improve health education and well-being among students across Timor-Leste. WHO's representative to Timor-Leste, Dr. Arvin Matur, sat down with RTTL World News to discuss the program's achievements and how its lessons will help shape future school health initiatives.
about the Say No to 5S program, what it sets out to achieve, and how it has been implemented.
It actually sets out to work with the Ministry of Education to make the schools as a safer place and make children healthier and to learn and grow in a safe environment. The challenges that one could understand that the students could face, from undetected health problems to the challenges of having access to safe sanitation, safe toilet, all of those issues that could be addressed, where they are also sometimes subjected to unsafe environment because of easy access to tobacco and tobacco products. All of this were collectively addressed through this program of Say No to 5S, which actually means saying no to starvation, saying no to smoking sweet and sugary beverages, saying no to skin diseases and soil transmitted infections, that is the lumbricoides.
So, Doctor, the program will conclude this month. What impact has the program had on students' well-being?
If I could say that somewhere I am very disappointed that the program is finishing this month, but I am very proud as what the program could achieve together by Health and Education Ministry. And why do I say so? This is the program now for the first time in Timor-Leste from grade 1 to grade 9. Almost 262,000 students have been screened for their health problems. So we have the information of all these students with the kinds of their status, the health situation, but also we were able to identify common problems, dental issues. The health screening could identify children with eye refraction problem. They needed the eyeglasses or ear-like problems with regard to the infection. But also, we identified some rare conditions as well. Yeah. And we could refer them and we could connect them to the health services.
Okay. 11 school clinics have been opened as part of the program. How will this be operated beyond the program's conclusion?
The 11 sites were the demonstration, and I would be, I'm kind of very pleased to say that they proved their worth. 5,700 consultations or interactions that these 11 health and wellness centers had, visits from students mostly. They handled emergencies. They also not only handled emergencies, but they referred children who needed the support from the health providers. These health and wellness centers also provided, as I said earlier, safe space for boys and girls to come and discuss and talk, receive counseling. They provided a space where the girls could actually access the sanitary pad without any shame or any guilt. So we were very, very pleased with the success and with the result that these health and wellness rooms have provided. But your question is very pertinent, how they would go beyond the project live. That's where I am looking to the government, the Ministry of Health and Education, for them to really take it on and move it from a project or a pilot to institutionalized approach.
So how will the result of the program be used to inform future health initiatives?
We do hope that the program results, as I mentioned earlier, as these are the results for the country, for the government, for the people, for them to review, reflect, and use them for the future. Our effort to continue to advocate, as I mentioned, that the program should, or this particular initiative should become institutionalized. This is where the whole challenge lies, that how the ministries of health and education are working to make it as a part of their regular routine program and working. Some of this is getting institutionalized. We would hope that in the days to come and in the years to come, the school health remain a very prominent part of the Ministries of Health and Education and for the students, the young students of the country.
Flavio Brandão says telemedicine will allow municipal doctors to consult patients directly without them having to travel to Delhi.
For blood tests, our patients must come to Delhi, but with the equipment that we are installing, patients can conduct diagnosis in their municipality and do not need to come to Delhi.
Teleconsultation kiosks will open personnel to perform a range of diagnostic tests, including blood pressure, electrocardiogram, body weight, oxygen saturation tests. WHO representative Dr. Armin Machu said telemedicine, the Minister of Health's health program, which aims to bring comprehensive health services close to communities.
At the community health center like Venilale, in Jumalai, the idea is that the patient doesn't need to travel, but the consultation from the specialist could be provided.
The initiative plans to eventually link the national hospital's resources with communities in all municipalities across the
Center like Venilale, in Jumalai, the idea is that the specialist could be provided. So with the telemedicine kiosks that we would be installing at these places, the teams from these places like HNGV, including the specialist from the 4 or 5 sites, they are here and they will be undergoing the 3 days of orientation.
Francisco and Muzino, as a participants from clinics in Bocau and Suai, appreciated the workshop.
Thank you very much to WHO and the Minister respond to the concerns that communities have been facing related to financial limitations to transport them to the National Hospital.
I see this as a good step. This equipment has been installed in Baucau municipality with the facilities that can help health centers and minimize any transfers to the national hospital.
WHO has committed to supporting the Ministry of Health in implementing the initiative nationwide, with plans for scaling up the program to follow after 1 year. Jerry Madeira, RTTL World News.
Football fans around the world are eager for World Cup, which kicks off tomorrow morning in Mexico. While the action is taking place on the other side of the world, excitement is building in Timor-Leste as fans prepare to follow the world's football event.
The World Cup is just around the corner. Football fever. From across the world are flown by eager fans.
As a young woman, I'm waiting enthusiastically for the World Cup, and I'm really happy the World Cup can inspire Timorese football players.
What I really want is Portugal to be the champions this year because it's the last World Cup for Cristiano Ronaldo.
I support Argentina, and I believe they will become the champions because Messi is the best football player in the world.
Julito Suarez, who also loves watching football, is taking advantage of the World Cup as a business opportunity by selling flags of the competing countries.
Young people want to be happy, to wave and relieve stress.
Among the flags of the participating countries, Julito also flies Timor-Leste's flag, with one hope that one day the small country can also appear in the World Cup. At Dili Stadium, a league match is underway, and while coaches and players compete, they all look forward to the world's biggest football competition.
I have always been a fan of a club, not a country. But in this World Cup, I hope Portugal can win.
Fans in Timor-Leste will be able to catch all the action as it's broadcast live on both Rttl TV and RTTL.
All the technical and content preparations are in full swing, and tomorrow morning we will kick off with a concert to entertain all football fans and our spectators. Our technicians have already repaired all the towers to ensure all Timorese can watch the World Cup.
From the streets of Dili to the stadiums of North America, the beautiful game is bringing the world together. Jageres, RTTL World News.
In international news, there are just under 1,000 First Nations medical practitioners in Australia, which is far from population parity. But one family alone is aiming to boost that, with 4 of its own entering the profession.
At 18, Aisha Nasser is the latest member in her family on course to become a doctor.
Just feel the happiest when I'm helping people in such like an impactful way.
Last year, her 2 older brothers graduated together with medical degrees. 22-year-old Jamal has hopes of specialising in surgery.
It's something that I should try and fill that gap in. But overall, medicine as a whole, it is lacking enough Indigenous doctors.
While at 24, Abdul is focusing on quality of care.
Just making patients happy and also just understanding the end goal is going to be working towards helping my own community.
All 3 are following in the footsteps of Mum Tatum. She entered medicine after raising her 6 kids.
Having family members go through very difficult sort of health situations, not having the support during those times was incredibly difficult, but also something that really inspired me to want to be able to, sort of give back in some way.
There are just over 960 Indigenous medical practitioners in Australia, but Indigenous pathways, like at the Badinami Centre at Western Sydney University, are helping to bridge the gap.
We just want to make those opportunities for Indigenous people.
Without Badinami, I'm not sure if I honestly would have made it through med school.
I would like to give some of my degree back to my community.
It was something that I thought, it's a bit out of reach, but seeing a lady with 6 kids do it, I couldn't use that excuse.
For Tatum, seeing her kids want to give back is the ultimate success.
It inspires me, and I think, wow, did we do this? We did. And it's just been very special.
A family breaking barriers in their community.
Another weather starting with Dili. Sunny with areas of high clouds in the morning, turning overcast in the afternoon. A top temperature of 33 and a low of 23 degrees. In Baucau, humid with some sun, turning cloudy with passing afternoon showers. Temperatures ranging between 28 and 22 degrees. Mostly cloudy in Lautem with a passing shower or 2 in the afternoon. A height of 28 and a low of 21 degrees. In Bobonaro, humid and overcast with a couple of showers late in the day. a top temperature of 27 and a low of 16. And in Aileo, high thin clouds in the morning, then mostly cloudy in the afternoon, with temperatures ranging between 26 and 15. Now looking abroad, partly sunny and humid in Kupang, a high of 33 and a low of 23. In Bali, mostly cloudy with showers increasing in the afternoon, temperatures ranging between 32 and 23. Partly cloudy in Jakarta with scattered afternoon thunderstorms, a top of 34 and a low of 23. In Seoul, overcast with a brief shower or two in the afternoon, a high of 26 and a low of 16 degrees. Mostly cloudy and humid in Dowry, temperatures ranging between 33 and 22 degrees. Overcast in Sydney, a height of 21 and a low of 13 degrees. In Lisbon, warm with plenty of sunshine, temperatures ranging between 32 and 19 degrees. Scattered showers in London, a top temperature of 16 and a low of 14. And in Belfast, periods of rain, a top temperature of 17 and a low of 12 degrees. Thanks for joining us again on the program. RTTL World News will be back with more stories on Sunday. Bye for now.